But we know they have upper extremity, so we don't have to do dressing for the upper body because there's no reason they can't dress, right? Because they have full use of the upper extremity. Some folks will, sit on the edge of the bed to dress or sit in their chair to dress when they are a person who has paraplegia. Some will do long sitting just because they have more support. So think of if we had a thoracic injury like T1, we're certainly going to have balance issues, and if we're long sitting, we have more stability. So James, let's say he has like T what? What do you want to be, James?
T1. T1 is fine.
T1. Okay, so he's going to have a little bit of issues with sitting balance. But he's in a nice long sitting position. He doesn't have to use any special technique to get into long sitting like a person with cervical spine injury would. And so depending on whether he has spasticity or not, it's going to determine how well he can bring his leg to himself. The key is setup, because getting in and out of the bed would be very tiring, so we'll make sure we have everything out and close by for getting dressed. So maybe the night before you get your clothes out and put them near your bed so you can access them. So James is going to grab one of his legs and bring it up to his body. You have full use of your hands, so you can use both. So you have full use of your hands, so you can grab your legs as normally. Good. And then he'll grab his pant leg and and dress the leg. And if he starts to feel himself losing his balance, he can always reach and stabilize himself. Remember, there's no movement, so the foot is not going to plantar flex for you to get your pant on. So it may be a little more work.
Ms. Crawford?
Yes, ma'am.
How much would they be propping for stability? Is it just
Not too much. The person's paraplegic would not have to do a whole lot. It just depends on how high level the injury is. So he may, if he's a T1, as the more movement demands put on him, the more likely he would have to reach and do some propping, because the more dynamic the task is, the more balance is required, he's going to have to prop more as a T1. Now, of course, you've got a person who's a lower lumbar, they're going to have more stability, they're going to have more trunk control, so they're less likely to have to stop and stabilize themselves. So in this case, James can rock side to side. Just lean a little bit, pull the pants up, back and forth. It's easier if you don't have clothes on already. And typically you would have enough control to do that, even if you're a T1, because you're actually leaning on one side while you go to the next side.
is that considered unweighted?
It is. He doesn't have to unweight like the cervical spine patient does, where they're throwing, they're using their head next to throw to unweight, but we all do that when we weight shift. Okay, good. Or can you come to the edge of the mat for me? Or James could, you're going to have to bring your legs with you. It's really hard not to use what you have when we don't have issues with spinal cord injury. So he could sit on the edge of the mat and pull side to side. A lot of folks who have paraplegia, we teach them how to lift themselves, like when they're doing transfer boards or when they're using blocks. And eventually, folks who have paraplegia will, most of them will get rid of the transfer board altogether, because they'll have good upper body strength, so they can do a side scoot or anterior posterior, where they can do the transfer that we've been typically doing just without the transfer board. So he could rock side to side and pull his pants up. Okay, James. Thank you, sir. You can take those off.
Okay. My legs are back.
Your legs are back. It'll be great. You can take those off.